I wanted to throw this slide in here, basically because I want to talk about effects of longstanding alcohol use on the brain. Wernicke's encephalopathy versus Korsakoff syndrome is super commonly tested right on step 1, as well as the psych shelf, the neuro shelf, step 2, medicine. I mean, it's everywhere. So a thiamine deficiency with injury to the mammillary bodies, almost often in the setting of alcohol use, as the triad of encephalopathy, ophthalmoplegia, so eye movement abnormalities, and ataxia. And so again, ataxia is sort of uncoordinated movements when targeting an object. It's typically reversible. You treat it with IV thiamine. This has a biochemistry correlate. Someone comes in, the test is often unkind and gives you some stigma of people who have alcohol use disorder. They tell you that this person is disheveled, this person smells like alcohol, they have a blood glucose of 55, and they want to know, what should you do? You think they have Wernicke's encephalopathy, but they have dangerous hypoglycemia. And you suspect that they have Wernicke's. So I have give thiamine before sugar. Yeah, I give thiamine first, right? So remember that thiamine is a cofactor in the citric acid cycle. So I give someone a ton of sugar, it's going to run through the citric acid cycle. It's going to get to that spot where it needs thiamine as a cofactor. Thiamine's not going to be there. It's going to worsen the thiamine deficiency. So you give thiamine first, then all that sugar can run through the citric acid cycle, no problem. Awesome. Korsakoff syndrome, I typically view it as the later end of the spectrum of Wernicke's. It's viewed as more permanent damage, irreversible, and sort of the clinical feature is confabulation. The hard part is picking out when they're prescribing this. What they'll do is they'll give you the patient telling a story and then a very clear, like that's not the case, right? So a patient will come in with cuts and bruises and they'll say, oh, how'd you get those? Oh, I was on a ride at the circus and I fell off. And they'll be like, well, there was no circus. And like, they'll give you something. These patients are not intentionally lying. The mammillary bodies are part of that sort of internal memory thing that we talked about at the very beginning of tonight. And the confabulation is sort of inventing memories because the ability to access them is not there. It's the best way I can describe it. So they're not intentionally lying, but they're making things up to replace memories that aren't there. Okay, the last thing, I always see people kind of miss this because we get so focused on alcohol use leading to Wernicke's and Korsakoff's that we don't think about what else alcohol does to the brain. Alcohol is a cerebellar toxin. If you think about bedside tests for DUI, they tend to be things like walking with tandem gait, right? Walking with one foot in the other, which is a test of cerebellar function, as well as watching someone's eyes kind of move in a coordinated fashion across a target. Your cerebellum helps do that kind of smooth pursuit. If it's not working, the eyes will sort of click along, right? So if you ever see someone who's had a little too much to drink, their eyes will sort of click if you have them follow your finger rather than sort of smooth following. Long-standing alcohol use can damage the vermis, so the middle of the cerebellum. And that can manifest with a gait disorder, right? So they can have a wide-based gait, as well as nystagmus, right? But typically you're going to see it on imaging. That's what they're going to tell you, that there's sort of atrophy of the vermis of the cerebellum. This text at the bottom jumped all the way down. This is for my OB shelf people, my future OBGYNs. What condition can also cause Wernicke's encephalopathy? Anorexia, good. Can. There's one I think maybe is a little more common. So first trimester patient who's having just a really rough go of it. Just every morning, just vomiting uncontrollably. Yeah, HG. So hyperemesis gravidarum can sometimes cause Wernicke's encephalopathy. I've seen it very, very few questions, but it's there.